Now we'll define the next terminology as associated to disease conditions that could actually happen in the gastrointestinal system. Although polyps can occur in the nose, polyps can occur in the uterus, but we are actually getting to learn about all these terminologies because we are currently talking about gastrointestinal system pathology. So pseudopolyps, you should know that they are non-neoplastic projections of inflammation or regenerating mucosa seen most commonly in the colon of patients with inflammatory bowel disease, especially what ulcerative colitis. So pseudopolyps, I don't know, but the name pseudo means something that is looking like polyps. Do you understand? So probably maybe they are not really true polyps, but they look like polyps. So how did it come about? In ulcerative colitis, there's repeated cycles of mucosal ulcerations and healing is occurring. So areas of mucosa that remain intact or regenerate project above the ulcerative surrounding tissues. So the raised islands of mucosa appear polypoid. So hence the name pseudopolyps. That means what? For them, they are not reactive lesions. So the real polyps, they have the tendencies of what? Becoming cancerous. So these ones will not become cancerous. They are non-neoplastic growths. Okay. So morphology, there's irregular polypoid projections into the lumen, sometimes numerous and confluent. On histology, there's inflamed granulation tissue, residual mucosa with distorted crypts, and it's usually surrounded by ulcerative areas. Okay, so clinical features is usually no symptoms, can also contribute to bleedings. Okay, can mimic adenomatous polyps. When you look at it on endoscopy, you might actually get to feel like it's a cancerous growth, but it's not. So clinical importance is when you see it, it could be that the person has been having inflammation in colon for a very long time. That's chronic colitis, but they are non-cancerous themselves. Okay, and all of that. Okay, so this is what we have for what pseudopolyps are.